Good morning, everybody. Welcome back. Fire Medic Adventures Unplugged. I'm here on my favorite walkway over to the Magic Kingdom. I've talked about this before, whether it be morning, afternoon, or night. Specifically in the mornings, though. This is one of my all-time favorite walks to get from the Ticket Transportation Center or near the parking lot all the way to Magic Kingdom. I've talked about this before. You can make this walk. It beats getting in that insanity over at the Ticket Transportation Center, which it's insanity this morning. So I thought what we would do while we're on this beautiful walk, we're going to talk about how to keep yourself safe at Disney World during the summer months, especially if you're on a certain number of medications. And what prompted this? Well, as I've related to before, not only do I work in an ER near the Disney and Universal and SeaWorld theme parks, but I also work inside the theme parks as a paramedic. And lately, I've been dealing with a lot of people who have passed out. And there's one thing they all have in common. That's what we're going to talk about. I'm sweating already. It's only 9 o'clock in the morning. Also, we're going to do another vlog at the Magic Kingdom. This is one of my few days off, so if you see me wearing the same giddy up, it's because I'm filming like probably 2 or 3 vlogs today. Anyway, one of the things I started piecing together with all of these guests that I've gone to that have passed out in the parks, or have come very close to passing out, or have passed out and then it's costing them an ambulance ride to the emergency room, and I see them there. There's one thing they all have in common. They're either A, on blood pressure medicine or on multiple blood pressure medicines, B, they take some sort of cholesterol medication, or C, they take some kind of SSRI, like Prozac. Anything that's basically for anxiety or any mental health issue. I mean, they've been prescribing SSRIs like candy lately, and that's a whole nother discussion about how dangerous those medications are. But I'm here to tell you that if you are in that category, let me add a fourth one. Stomach acid reducers, omeprazole, pantoprazole, all of the stomach acid reducers. Some people are on multitudes of these medications all at once, which is baffling to me. And you might say before I start into this, well, Matt, what do you know? You're just a paramedic. Yes, I am just a paramedic. And I'm one of those paramedics that does a absolute crap ton of research on medications. And not just what TikTok or ChatGPT or even WebMD tells me. I read books. I do a deep dive into this stuff, because once you go to a few of these people that pass out and you notice, hey, they all have one thing in common, you start scratching your head going, is this an off thing or is there something else going on? And then you start seeing more and more and more of this. You start telling yourself, you're like, self, something's clearly up, because there's one thing all these people that pass out have in common. They're all on these medications. So why? What's going on? What's causing this? Well, I have that answer for you. So if you are in this category and you take one or more of these medications, you really, really, really need to pay attention to yourself on your Orlando vacation during the summer. Disney World, SeaWorld, Universal, any of the theme parks, Busch Gardens, Tampa. If you're going anywhere in Florida, especially in the summer, theme parks especially, because you're at a higher activity level, most people are more active on their vacations here at the theme parks in Orlando than they are during 90% of their regular lives. And I'm not saying that to be mean, that's just a fact. And a lot of people now we get are from overseas, the UK, Scotland, Ireland, etc. Or they're from the Northeast, Massachusetts, New England area, New York, Pennsylvania, Midwest, Ohio, Indiana, Minnesota, Wisconsin, Iowa, even out west, Northern California, Oregon, Washington State, Montana, Colorado. They're not used to this. You are not used to this. And I don't care how much you read, I don't care how much you research, I don't care how much YouTube you watch, nothing can prepare you for being here in Orlando at the theme parks during summer than being here. You have to experience this. When I moved here, it took me at least 2.5 years to fully get adjusted to the summers here. Outside of summer, it's fabulous here. It's amazing. Summers, though, you got to take with a different strategy. And this is where there's a lot of bad advice on social media. Stuff like rope drops, spend all day in the theme parks, go home, back to your hotel at midnight, 1:30, 2 o'clock in the morning, get everybody back up at 5 a.m. to do it all over again for a week and a half, 2 weeks straight. Folks, you can't do that during the summer. Not only is that stupid, but it's dangerous. And where this ties in is all of you that are on those medications that I listed, blood pressure medicines, cholesterol, stomach acid reducers, SSRIs. The SSRIs don't allow your body to regulate temperature. They tell your hypothalamus, don't worry about it, it's fine. You don't have to regulate temperatures. You folks in this category overheat very easily. And you may have experienced that doing other things in your life. You're like, what happened? Or you may have had a doctor tell you, I'm not sure what's wrong, you just overheated. 90+ percentile of chance it's your medication. The rest of you that are in the blood pressure medication category, what happens with you folks is you take that medicine, and when you go out into a very hot climate, hot, warm climate like Florida and humid, when you're walking and you're active in the theme parks, your brain tells your heart, hey buddy, I need some more oxygen, I need some more blood flow. Send it ASAP. And the heart's like, you got it. And then all of a sudden the heart goes, oh shit, I can't, because I got something telling me not to. Because you got that blood pressure medicine going, I don't think so, bud. No. We got to keep this blood pressure down. The heart's like, listen, dude, I can't do this. I need more supply. And the brain's up there hollering, going, where's my oxygen? Where's my blood? And the medication's going, I don't give a shit what you all think. You ain't getting it. And the body says, you know what? Screw it. We're taking a break. Pass out. You pass out to go from vertical to horizontal. It's a lot easier to move blood horizontally than it is vertically. So when a patient passes out, it gives the body a minute to restore itself, to regroup. And you all in the blood pressure medicine category, you experience this a lot. And I'm telling you, 9 out of 10 folks I go to in the theme parks that pass out are on blood pressure meds. And they all say the same thing, I don't understand it. And then when you break it down, they do understand it. And they're like, well, why didn't anybody tell me this? I said, not to be mean, but most doctors don't have a clue what they're prescribing. And I don't say that to be mean, but they don't. They have a very limited time with pharmacology, and they give these meds out, and they just say, take them. And people take them like lemmings. They don't ask questions, nothing. Blood pressure medicine really starts being ineffective and harmful after about 3 to 6 months. You cannot suppress your blood pressure day after day and not expect horrendous results. It doesn't work. And people that I talk to, how long you been taking that? 10, 20, 30 plus years. Folks, your body hates you. And the thing is, you can't stop that stuff either. You have to come off of it gradually. To which my argument always is, you mean to tell me that the only way to lower somebody's blood pressure is by giving them pills? Get out of here. No way. Like that railway company, Norfolk and Way. And so when you talk to patients like this, it kind of opens their eyes. And they're like, holy cow, nobody ever mentioned this. I said, I know. And sadly, they don't. They're not going to tell you this. And then you might say, well, Matt, what do you know? I know this because I research and I read. And I look at the studies and I break everything down. And blood pressure medication is the absolute worst thing to be on if you're out in the heat. Straight up. Because, again, your body cannot supply itself with the crucial blood flow that it needs. We had a patient the other day brought to us by the ambulance. Blood pressure, 50/30. Folks, that's barely compatible for life. And what was happening is their body needed more. The medicine said nay, and it squashed this person's pressure. And the only thing, the way we brought it up was 3 to 4 liters of fluid through a rapid IV infusion, and of course blood work. And after about 2.5 hours, 3 hour stay in the emergency room, they were fine. And they took some of what I had said and went back to their vacation. And I told them, as you're on this medication, you can't go all day, every day in the park. The only way to do this is you got to get up early, get here in the morning, go back to your room, hotel at noon, 1:30 at the latest, and then come back about 6:30 at night. You cannot run your body all day in these parks taking those type of medications. You just can't do it. I mean, if you want to, go ahead, but I promise you, I'll see you in the emergency room. And I hate talking like that, but that's facts. Because you're going to have a problem. And you might say, well, Matt, I've never had a problem. You might not have. You might have gotten very lucky. But blood pressure medicine works by pulling all of the fluid out of your system. Okay? It's not a magic bean that just tells the body, oh, lower the pressure. There has to be a reason. There has to be a rhyme for the reason. So it makes your body excrete fluid faster, which removes more fluid from the container, which causes your blood pressure to drop because there's less fluid in the container, less pressure. Well, when you start losing fluids like that, on top of being in Florida, on top of being severely dehydrated, which 90+% of Americans are, it's a recipe for disaster. And again, you're going to pass out so your body can renormalize itself, and then you wake up again and you feel better. Now, the rest of you that are on the stomach acid reducers and cholesterol meds, stomach acid reducers and cholesterol meds dehydrate the crap out of you as well. You cannot hold water very well. It causes a litany of other health problems. The stomach acid reducers actually prevent your body from digesting the other medications you take correctly. So they tend to sit there and they digest slowly, they digest more slower than they should. So the people that are on the whole conglomeration of medications that are on the blood pressure meds, the cholesterol meds, the stomach acid reducers, and the SSRIs and whatnot, you all are creating a cocktail of disastrous proportions that you're very lucky nothing has happened yet. Because again, you slow your digestion down and your body cannot digest those meds as it's supposed to. So you seriously run the risk of an overdose doing that. That's why they tell you don't ever take pain medication or any type of other medication with grapefruit juice or citrus, because citrus slows down your digestion. You can accidentally overdose yourself with a simple medication by taking citrus with it. They should have the same warning label with the stomach acid reducers and all that, but they don't. It drives me crazy as a healthcare provider of almost 20 years. So folks, please take this seriously. And we're going to do a deeper dive later on how to stay safe at the parks in the summer and what you need. But this is more of a public service announcement, if you will, a PSA on things to look for if you take these medications and you're here in Florida. And take breaks, take your time, don't go all day. Drink water. Your body weight in pounds equals ounces of water. 200 pounds, 200 ounces, 150 pounds, 150 ounces. You need that at bare minimum to maintain is what we call homeostasis, or maintain life. When you start dropping below that, your body says, hey buddy, I need a break, we're passing out, and you pass out. A pass out 90+% of the time is not dangerous. It's your body's way of saying, we're taking a break now and you have no say. Other times, the other less than 10%, it can mean something more significant, but 9 out of 10 times it's because your body needs a minute to readjust, and that's what it does. It passes out and you wake up and you feel much better. But let's not get to the pass out stage. Folks, you got to take care of yourself, and seriously ask, play hardball with your docs. All these docs that are prescribing people these multitudes, especially the blood pressure and cholesterol meds and that, ask them, what's the long-term benefits? What is this doing? Ask them to explain the pharmacokinetics, as it's called. What is this thing doing inside my body? What does it do when I get into a warmer than normal environment, like theme parks in Orlando, Florida during summertime? What does that do? And if they can't tell you, it's either time to stop taking the medicine or have them wean you off of it, and then find somebody that can explain it to you, and then what are the long-term and short-term benefits. Because realistically, blood pressure medicine especially, and cholesterol medicine, and even the stomach acid reducers, even the SSRIs, the longer a person's on them, the worse the side effects get, and the more potential for severe problems start coming into play. There is a lot of data now that shows long-term use of these medications can be very, very bad for you. And again, we'll break that down at another time. And again, how is it that a paramedic has more knowledge on pharmacology than a doctor does that goes to school for almost 10 years? Well, I'll tell you why. Because doctors don't get a whole lot of pharmacology. And you could argue, oh, of course they do, Matt. They get a lot. I'm telling you, they don't. We don't as medics either. However, I choose to educate myself by reading books, by reading literature, reading studies, reading all about the most commonly prescribed medications and what they do, so I can be better prepared to handle a patient that has a problem or has a potential problem with these medications. Example being passing out at a theme park in Orlando and being on one or more of these medications. So I hope this helps y'all. Again, if you're going to be here during the summer especially, and you take those mentioned medications, you got to hydrate like crazy. You got to eat breakfast, lunch, and dinner, and you got to drink water in the equation of 1 ounce of water per pound of body weight. Like I said, example, 150 pounds, 150 ounces, 200 pounds, 200 ounces, so on and so forth. And I know some people might push back, oh man, I'm not drinking that much water. Fine, then don't. But I'm telling you, I'm giving you the tools of what you need. If you don't want to do it, don't do it. But then if you end up passing out in the parks, don't come to me and say I didn't tell you so. All right, everybody, we're on to the next project. Heading to Magic Kingdom. Hope you've all gotten some out of this. It's been the truth, it's been actual. Hope it's been satisfactory. See ya.